Kinesiology taping for anterior knee pain. So what is anterior knee pain? Well, it can be classified as many different things, and one big umbrella for pain in the anterior part of the knee is patellofemoral pain syndrome. And other diagnoses that you might find, or differential diagnoses, are conditions such as chondromalacia patella, which is a softening of the cartilage of the patella, patellar tendinopathy, and also Osgood-Schlatter's, which we have discussed in another online learning. If you are not qualified to diagnose any of these conditions, always refer on to someone that is able to do so. For the purpose of this training, we are going to be focusing on a patient that is experiencing some anterior knee pain, potentially due to a patellar tendinopathy, and the tape is therefore trying to provide some support to that area. So some potential or possible causes of anterior knee pain are often to do with the joint itself or the muscles and tissues surrounding the joint. There may be some overload or overuse of the patellofemoral joint itself. Also some muscle weakness, imbalance, dysfunction, or perceived tightness of all of the muscles surrounding the knee joint itself. And they may include the quadriceps, the hamstrings, gastrocnemius, the iliotibial tract, and even to the long adductors as well. As with anything, it's really important to assess before you go into treatment to find out you're taping and treating the correct issue that your patient has presented with. For the purpose of the taping in this video, the client has been experiencing anterior pain around the patellar area, and it's due to a general weakness within the quadriceps muscle group. When working with clients or patients with anterior knee pain, it's important to consider all different options based on what you found in your assessment or examination. You may want to consider overactive quadriceps, and you may need to inhibit those quadriceps and or increase range of movement and flexibility through the quadriceps tissue to increase range of motion at the joint. You may want to decrease that pain around the tendon and reduce any inflammation around that area if your client is presenting with acute pain. There may be weakness in one or more of the hamstrings creating that pain. So further into your treatment, you may want to consider some quadriceps strengthening. And also in looking at that range of motion, there may be perceived tightness in the tissues around the knee and also the hip. So muscles such as the hamstrings, the gastrocnemius, the hip rotators can all have an effect on what's happening in terms of the anterior knee. So as you can see, strength and range of motion is really important to help clients with patellar pain or anterior knee pain. And it's important to integrate this into your treatment plan alongside the taping. So let's begin with the taping, looking at acute and early subacute phase of treatment with kinesiology tape. Here are the key points for kinesiology taping for anterior knee pain. To recap for this client, the client or patient has been experiencing anterior knee pain, but it's due to an issue of strengthening of the whole of the quadriceps muscle group. So our taping is going to be broad. So the two-step process to begin with is about inhibiting the quadriceps muscle group in total and also offloading the tendon towards the patella to help reduce that pain and sensitivity in the area. If there's any inflammation present, then you can use a lymphatic drainage taping around the knee joint and also pain desensitization taping where required. And if you have found any issues with the lateral knee, then review the lateral knee pain taping video also. So we begin with inhibition taping for the quadriceps. We make a long anchor of the tape, applying it on the tibial tuberosity and sticking it down on a relaxed knee. We then apply a stretch onto the tissue by bending the knee, and with light tension on the tape, we apply the tape along the midpoint to the centre of the quadriceps muscle group. We then straighten the knee to attach the anchor on relaxed tissue and then stick the tape down. And once you have finished the quadriceps inhibition, we can start offloading the tendon at the patella, and you can do this on its own also. So you break off the paper at the centre of the tape, and then you want a heavy resistance, a heavy tension on the tape. And you want your anchor to go in and upwards towards the patella. stick the section down in the centre and then relax the knee to apply the anchors on both sides and then rub to stick the tape.